I know, and you mentioned it a little bit, you've done research in this. So you've talked about disease-related symptoms. You've
Yeah.
talked about how you kind of differentiate that and, adverse events. A lot of the development of there's now many, and I'm not an expert in this, so would love for your opinion. But we have an EORTC
Mm.
um, profile or questionnaire. We have a FIXI DRS. We have a
Hmm.
FIXI 23. I think we have a FIXI
Hmm.
19. I wonder, as we're working on developing and I think trying to hone in on what are the right questions to help assess, the healthcare related quality of life measures. Where do you see these going in the future, and how do you
Hmm.
see us maybe, using them, or do you see us using
Yeah.
these kind of on a daily basis?
Yeah, I do think that so I think these are really important to capture the patient experience outside of just AEs. I think it's really tempting to sort of conflate adverse events or side effects and quality of life, and they are actually separate because we all know patients who are they're taking their Imodium, they're using, clobetasol in their hands, they're, putting they may have a pustular reaction, so they're putting clindamycin cream on their chest or their face, and they still are making their way through life in a way that feels authentically good. That is, again, those they have crosstalk, but they're separate. And so I do think that capturing the patient experience is really important, and yet that needs to evolve just as the way that our technology is evolving for measuring for treating the cancer itself and measuring the cancer. Again, for some of the cancers that we treat in genitourinary oncology, the way that we measure the cancer, it's a change in, right? We have PSMA PET scan that we may use in the future to assess extent of disease response compared to the quote traditional measurable disease criteria that we use with RECIST now. So we need to evolve. I think that a lot of the evolution that's going to take place is maybe us using shorter questionnaires and again, to the extent that they still capture the global patient experience, and that needs to be driven by patients. And there's a lot of I mean, there's so much incredibly rich science around that. But I would also say for patients who are outliving their lives, we are all using our devices a lot. And I think when patients come to clinic, they're in a very particular headspace. But when they're actually at home, wherever their home is, and doing what they normally do, that's really the best and I think the most accurate assessment about their global quality of life. And we all know this because we'll have patients who come to clinic and tell us one thing, and their spouse, partner, child, friend is elbowing them and saying, "Come on, Harold," or whoever it is, "that's not what you told me," right? So I think that an important evolution that we're going to go through in coming time is going to be to capture that in a short, maybe shorter snippets that we can text someone a link, they complete it, and maybe even using AI to kind of have an adapted questionnaire. So if someone says, that they're not having urinary symptoms, then we can, route them to some questions that maybe are more relevant to them. I think that's where the science is going to go. I think it's inevitable. I think we're starting that now. And I think it will provide us a better understanding about how people are living with cancer.
Yeah, I love that. So today I feel like you've given us all the tools. Now we have tools to talk with our patients about their disease related side effects, how to talk to them about what's important to them. Um, and thinking forward about, wow, that would be really cool if we could have like an AI adaptive platform of doing surveys, for patients and getting that snapshot of what it is like to, be at
Mhm.
home and living and then coming into us and, helping them kind of get through that journey. So I also appreciate the words I'll be using with my children
There you
later
go.
on and
Full service.
presenting with curiosity. So just really love that. It's always, of course, such a joy to chat with you. And thank you so much for joining us. And I hope that the GU Oncology Now community found this to be a interesting and a delightful conversation that you all can take, use these words, with your patients as well.
Thank you so much.